Good evening, good evening, good evening. Happy Friday. It is Nurse Eunice here with another live review of questions. Tonight we'll be covering clinical skills for nursing assistants or nursing students. So if you're just joining us, please put your name, where you're actually watching us from in the chat, and we're going to get started in a few moments. Again, this is Nurse Eunice with Florida Training Academy. Let's review some practice questions. All right, so number one, a patient with a nasogastric tube complains of difficulty breathing. What should the nurse do first? Is it A, assess tube placement, B, administer oxygen, C, remove the tube, or D, call the physician? A patient with a nasogastric tube complains of difficulty breathing. We'll reveal the answer in 3, 2, and 1. If you chose A, assess the tube placement, you're absolutely correct. Difficulty breathing in a patient with a nasogastric tube could indicate that the tube has migrated or moved into the airway. So, assessing the tube placement is the priority to ensure that it is correctly placed. And then, if you find out that it's incorrectly placed, you can try to position it correctly. And then, worst case scenario, you would have to remove the nasogastric tube. Question number 2. Which action is essential when administering medication via an intravenous or IV bolus? Is it A, administer it slowly over 5 minutes, B, dilute the medication with saline, C, monitor for signs of infiltration, or D, ensure that the IV line is patent? And good evening, Tamika and Niyu. We'll be revealing the answer in 3, 2, and the correct answer for this one is going to be D, you all. So I see a lot of you all chose C, monitor for signs of infiltration, but what we usually refer to it as is making sure that the IV is patent. And so that's when you can monitor, but you also want to try to flush it with saline. So ensuring the IV line is patent is crucial to prevent complications such as extravasation, or that is when they can have tissue necrosis, Friday night, my tongue isn't working, or tissue damage. So flush it first, and if you see anything abnormal before you even attempt to flush it, you may have to go ahead and take out that IV and start a new one. Number 3, what is the priority action when caring for a patient experiencing a seizure? Is it A, restrain the patient, B, administer medication as ordered, C, place the patient in a sideline position, or D, insert an oral airway? Great job, everybody. Majestic, Carrie, and Raw. If you chose C, you are correct. So placing a patient in a sideline position helps to maintain a clear airway and prevents aspiration during a seizure. Question number 4. When performing wound care, which solution is appropriate for cleaning a contaminated wound? Is it normal saline, hydrogen peroxide, betadine, or tap water? All right, so I saw C, B, A, C. And so for this one, everybody, if you are choosing B, you're absolutely old school. So hydrogen peroxide it actually can erode the good tissue and the bad tissue. So we don't use peroxide on wounds. The correct response is going to be A, we use normal saline. That's what we use to clean most wounds because it's isotonic and it minimizes tissue irritation. Number 5, which technique should the nurse use when administering an intramuscular injection to an adult patient? Should he or she insert the needle at a 30-degree angle, aspirate or pull back on the plunger before injecting the medication, massage the injection site afterward, or insert the needle at a 90-degree angle? What do you think is correct? Revealing the answer in three, two, and I did see the correct answer. So, yeah, so you all, we don't aspirate, we don't pull back before injecting. That's not current standard. The current standard is whenever you're doing an intramuscular injection, you're going to do D. You're going to insert that needle at a 90-degree angle, and that ensures the proper disposition of the medication into the muscle tissue. Number 6, what should the nurse prioritize when caring for a patient with a chest tube? Assessing the lung sounds once per shift is A. B, monitoring drainage output. C, administering pain medication. Or D, encouraging deep breathing exercises. And for my CNA students who are also watching this video, even if you may not know some of the answers, just chime in because my goal is for you to be future nurses, aka future nursing students. So take notes, let's learn together. And for this one, if you chose B, I'm so proud of you. You are correct. So, whenever someone has a chest tube, you want to monitor the drainage. A is not correct because A said you only want to assess the lung sounds once per shift. You'd assess them per shift and as needed. But when someone has a chest tube, as indicated in the image, this patient has a pleural effusion, excess fluid around the lung, and we're going to insert a chest tube. And so that's going to drain it into this collection device. And what we need for our CNAs and our nurses to do is to monitor the output because monitoring the drainage is crucial for assessing the patient's response to the treatment and detecting complications such as hemorrhage or pneumothorax. So if there's not any drainage and your patient's breathing is changing, there could be an issue. Maybe there was a clot in the system, or maybe the tube has become displaced. So monitor for drainage, and that will help alleviate some of the problems that could occur for patients with chest tubes. Number 7, which intervention is appropriate for preventing pressure sores or pressure ulcers in a bedridden patient? Do we want to massage over bony prominences? Do we want to reposition every 2 hours? Apply heat to vulnerable areas? Or elevate the head of the bed? How do we prevent pressure ulcers? Yes, Carrie, Edith, Mama, it's me. Great job. We want to reposition every 2 hours. You never want to massage over a bony prominence. That is not current standards. If you massage over a bony area, you're more likely to cause irritation and you can cause a pressure sore. So reposition your patients every 2 hours and more often if requested or needed. Number 8, what is the priority action when caring for a patient with a urinary catheter who complains of bladder discomfort? A, administering a urinary analgesic. B, irrigating the catheter with saline. C, assessing for signs of urinary retention. Or D, removing the catheter. And remember, when you're taking this test, you are a nursing student. You're going to be a nurse, so I want you to put on your nursing caps. What do you think the correct response is? Mama, you failed your written test. Send me your results. I'll put my email address in the chat. Most of the time, when people fail their written test, I find they didn't study medical terminology. And so send me your results and I'll try to figure out how we can best assist you. And for everyone who selected C, you are right. Assessing for signs of urinary retention. So, bladder discomfort in a patient with a urinary catheter could indicate urinary retention, and assessing for this would be priority. Remember, when they have a catheter, the urine's supposed to just drain on its own. So, if the urine's not draining because there's a clog or because the person has kinked it with their body weight or their leg, that's going to cause urine to build up. Thus, they would have the bladder distension and the urinary retention. Number 9, which technique should the nurse use when administering eardrops to a child younger than 3 years old? Is it A, pull the pinna or the ear up and back? B, pull the pinna or the ear down and back? C, insert the dropper straight into the ear canal. Ouch. Or D, tilt the child's head toward the unaffected side. All right, we're going to get you ready, Mama. You're doing the right thing. You're finding our videos. I'm not sure how you found us, but welcome. We have a whole playlist with CNA practice questions and videos to help you pass the CNA test. And I am so proud of you all. You all, it's not C. It's not C. C is going to hurt. Give me an answer that's not C. Yes, Tamika. So, all right, Mama, we're going to focus on this video. So take notes and learn new terminology. So that's how we're going to help you today. So B, you're going to pull the ear or the pinna down and back. And the explanation is gently pull the outer ear down and back for children. And that's how we straighten their ear canal. And for an adult, you pull the outer ear up and back. So adults up, kids down. And that's how you straighten the ear canal so you can install your eardrops. Number 10, what is the priority assessment when caring for a patient receiving intravenous IV therapy? And this should be easy for you all. Is it you monitoring the blood pressure, the temperature, the urinary output, or the IV site integrity? If you chose D, yes, you are correct. So we're always monitoring. You're going to monitor that site because that patient could have phlebitis. Oh my God, it looks horrible. And so phlebitis could happen because of infection, or sometimes those wonderful nurses push the medications too fast, and the medications can be caustic, or they could actually damage the vein. And so you'll start seeing bruising. And of course, the patient's going to say, ouch, because this burns and it hurts. So always assess the IV site integrity. That's how we're going to prevent complications such as infiltration, which is when the IV fluids go, they leave the vein and they go into the surrounding skin. And phlebitis is what you see there. It's the inflammation and the redness. Number 11, which action should the nurse prioritize when caring for a patient with a newly inserted tracheostomy tube? Is it A, suctioning the airway every 2 hours, B, removing the inner cannula for cleaning, C, ensuring a proper cuff inflation, or D, administering humidified oxygen? This one may be tricky. Let's see what we have. We have D, we have A, we have C, we have A. And the correct response is yes, it is C. So let's go to it. All right, so everybody, in the image that I have on the screen, all right, whenever someone has a trach, the way that we ensure proper cuff inflation, so some of the trachs are going to be cuffed. And this blue balloon that's outside that says the palate balloon, this will be inflated. So whenever the external balloon is inflated, it lets you know that the cuff, if you look at the image, you see the cuffs. That's what's keeping the trach positioned in the patient's neck or trachea area, and it prevents air from bypassing, going places it shouldn't go. Remember, this is now this person's airway. This is their nose. This is how their fluids come out. This is how they let air in. So we have to keep that trach cuff inflated. So proper cuff inflation prevents aspiration and maintains adequate ventilation in patients with a tracheostomy tube. So anytime your patient has a trach and they have that palate balloon or that blue port sticking out, you just usually just press on it with two fingers. And when you do that, it should feel like it's inflated. And if that's inflated, that would tell you that that internal cuff is also inflated. So you want to be monitoring that when you do your trach care and when you look at your patients. Number 12, which assessment finding indicates effective oxygenation in a patient receiving oxygen therapy? Is it a respiratory rate of 16 breaths per minute, pulse oximetry reading of 90%, pink moist mucous membranes, or inspiratory crackles auscultated bilaterally? And that's a fancy way of saying that you used a stethoscope to listen and they had crackles. So how do you know if the oxygen therapy is effective? This one's tricky because we shouldn't have a person whose O2 sat is 90% if they're on oxygen. That's not effective. That is ineffective. So the goal of oxygen therapy is usually for your patients to have an O2 sat of 94% or better. Rincy! Yes! So Rincy has it, everybody. So pink moist mucous membranes. Remember, when something is pink, that's usually a sign of adequate oxygenation or circulation. So for this one, pink moist mucous membranes indicate adequate tissue perfusion and oxygenation. So in other words, you can either look in the mouth and the gums are pink, or what I'd like to tell you all to do, because some brown skinned people don't have pink gums, we have darker gums, is check the fingers, check for capillary refill. And if those hands are pink, that would be another way to indicate that the person has proper oxygenation or circulation. But an O2 sat of 90% with oxygen is not sufficient. Next one, number 13. What is the priority action when caring for a patient with a Jackson Pratt drain? And you know me, if you've never seen a JP drain before, no worries. I got pictures of it on the next slide. But is it A, clamping the drain during ambulation, B, emptying the drain every 8 hours, C, maintaining negative pressure in the drain, or D, assessing drainage characteristics? You have a patient who's had surgery and they have a drain. What do you think is important? Rosina has it, everybody. You all, that drainage could be bright red. It could be a lot of it. That would mean they're probably bleeding more than normal. So on the first post-operative day or the day of surgery, we expect to see more drainage than we would see on the second day. So when you look at this image, this person has had, they've probably had some type of chest surgery, because you see the binder is around their chest, not around their stomach. And those drains are draining off that excess blood, that excess fluid that has pocketed or built up. And so as a CNA, as a caregiver, you want to be emptying those drains at least once per shift and or anytime it is halfway filled. Because if it becomes halfway filled, it's not going to allow more blood or more drainage to drain into the Jackson Pratt bulb, or we call it a JP for short. So I hope you learned a new a new term, but our explanation states assessing drainage characteristics helps to detect signs of infection or complications. So if it's bright red, that usually indicates, true blood. But let's say it was milky or pussy, that would indicate, I should say pus like. I shouldn't say pussy. I don't even know if pussy is a word. Forgive me, it's Friday night. So, but if it was milky or cloudy, that would indicate infection. Number 14, which intervention should the nurse implement first when caring for a patient with a suspected air embolism? An air embolism is when air enters the vein and or the artery. And that usually can happen because the nurse maybe didn't properly um, they had still had some air in the IV tubing or air in the syringe, and they could have pushed it into the patient's body. So, which intervention should the nurse implement if this happens? Is it A, administer oxygen, B, place the patient in a Trendelenburg position, C, initiate cardiac monitoring, or D, apply a tourniquet above the insertion site? And Tamika and Mama and Dewa and Chrissy, I'm so proud of you. Yes. So you're going to place the patient in a Trendelenburg position because it helps to prevent the air from traveling to the heart and the lungs in case of a suspected air embolism. So hopefully the air will stay kind of in the leg area. But you want to try to change their position. So hopefully that never happens, but the way to prevent it is to make sure that you're not pushing air into your patients. You don't let your lines run dry, etc. Number 15, what is the priority action when caring for a patient with a continuous bladder irrigation, or short, we call it CBI? Is it assessing or monitoring urine output, assessing for bladder distension, adjusting the irrigation flow rate, or administering pain medication? Continuous bladder irrigation. I'm so proud of you. I'm so proud of you. I see Chrissy. I see Miss Love. I see Carrie. I see Chidinma. I probably messed it up, but I love you. All right, so let's see. I see Rosina. I see Carrie. Let's see what answer is. It's either A or B based on your responses. And you all, it is A. You're going to monitor for urine output. So, monitoring for urine output is essential for assessing renal function and preventing complications such as bladder distension or dehydration in patients with a continuous bladder irrigation. So, a lot of times you'll see this whenever a male has had a surgical procedure on the prostate. So if they've had their prostate removed or a surgical, maybe we tried to open up something in your urethra, we can't let the blood just sit because it will form clots. So we have to irrigate their bladder. And so the top bag you see is the irrigation bag, similar to what IV fluids would be in. But the doctor would have that actually connected to the bladder. So it's like a tube that would go through the urethra or the penis. And so it's a big tube. One part of it flushes or pushes fluid in, and the other end is connected to a drainage bag. So if we have fluids continuously going in, we need to see fluids continuously coming out. So the same rule applies if you're the CNA or the nurse who's taking care of somebody who has a continuous bladder irrigation. You want to make sure that that drainage bag doesn't get too full. You're going to be emptying that bag at least every time it gets halfway filled, because we know that it's going to get filled more frequently. And if for some reason you're late and you don't empty that bag, you're going to cause your patient to have bladder distension because it's going to end up getting filled with the fluids that has been irrigated with. Number 18. What intervention should the nurse prioritize when caring for a patient with a central venous catheter who develops a fever? So central venous catheter, this is a large bore. It's more stable than an IV, and this is usually put in by a physician. So, are you going to administer antipyretics? Are you going to initiate broad spectrum antibiotics? Are you going to remove the central venous catheter? Or are you going to assess for signs of infection? So, your patient has a fever, but they also have a central line. What should the nurse do? It's me. You can't see me tonight, Chrissy, Rosina. You can't see me tonight because my hair's not done, but I'm so proud of you. Yes, smart nurses. You're going to do D. You're going to assess for signs of infection because the central line could have become infected. And if we don't take care of it, the patient could become septic. So, assessing for signs of infection is crucial to determine the cause of the fever and guide appropriate interventions in patients with central venous catheters, or short, we call them central lines. Number 17, what is the priority action when caring for a patient with a wound vacuum assisted closure device? You all, we call it a wound vac for short. So, should you change the dressing daily, irrigate the wound with saline, ensure the adequate seal of the vac dressing, or administer prophylactic antibiotics? Oh, wow. Abby Ramy? And Carrie and Mama, I am proud of you. You all want to make sure that dressing is intact. So, ensuring the adequate seal of the vac dressing maintains the negative pressure and promotes wound healing. And so, this is an image of somebody who has the wound vac. So, we have this plastic, we have a black foam that is actually measured, and that is what sits inside of the wound. It makes like a vacuum seal, and it provides oxygen or air, but it also sucks out the drainage into this enclosed container, aka the vacuum pump. That dressing can be changed out about 3 times per week. But if you're the caregiver who's taking care of a patient with a wound vac, your job is to make sure that seal doesn't break, and if it does, that you either change it or you notify the wound nurse to get it changed. It will beep loudly if there is a break in the seal. Number 18, which intervention should the nurse implement when caring for a patient with a chest tube drainage system? Is it A, clamping the chest tube during transport? B, keeping the drainage system below the level of the patient's chest? C, stripping the chest tube to promote drainage? Or D, removing the chest tube if the drainage stops? Patient has a chest tube. What do you do? Awesomeness, team. Awesomeness. So, yes, you want to do B. You want to keep the drainage system below the level of the patient's chest. It's kind of like a urinary catheter. If you bring the chest tube up or the collection device up, you can cause a backflow of the old drainage, the blood, and you can make that go back into someone's body. You can cause an infection. So, anything that's inserted into a person's body, for the most part, should be kept below the level of the heart. So it should be always dependent or downward. And also, the chest tube should never be connected to the side rail. There's usually going to be a frame, some type of hook or something on the frame that the mattress sits on. And that's what you want to connect your chest tubes to. But most of your chest tubes will have a stand so it can sit on the floor. Just be careful whenever you're providing care around the patient's bed that you don't accidentally kick or turn over the chest tube if it's not secured to the bed frame. Number 19, what is the priority action when caring for a patient with an external ventricular drain, or EVD? Is it monitoring intracranial pressure, or ICP, administering intravenous antibiotics, irrigating the drain with sterile saline, or assessing for signs of meningitis? So you can tell by the responses we must be talking about the brain. So, what do you monitor for when you're caring for somebody who has a drain in their brain? Yes, it is. A, you're going to be monitoring for the intracranial pressure. So, external ventricular drainage is a temporary method of draining the cerebral spinal fluid from the ventricles in the brain. And so, monitoring the intracranial pressure is crucial for detecting changes in neurological status and preventing complications. So, unless you're working in like a ICU, you'll probably never encounter these patients. But whenever someone has an increase in their an increase in ICP, the head of the bed should be slightly elevated because remember, when something is up, it makes those fluids drain down. But in this image, we see where the person has had some type of brain surgery. They've shaved the head, but there's a device that's going to be monitoring. It's called a transducer. It's going to be monitoring their intracranial pressure. So again, you probably won't see this unless you're working in a neuro ICU, but at least you're aware of it now. Number 20, which intervention should the nurse implement first when caring for a patient with an arterial line who exhibits signs of arterial occlusion? So think of what an artery does and think of what happens if the blood flow cuts off to an area that the artery feeds. So are you going to do A, notify the healthcare provider? B, assess distal pulses. C, flush the arterial line with heparinized saline. Or D, remove the arterial line. I, let's see. I see a lot of A's, but the doctor's going to ask a specific question. If a person has an arterial line and they have signs of occlusion, one of the first things a good caregiver would check for would be the pulses. So if you call the doctor and says, "Hey, the patient has signs of an occlusion," the doctor's going to be like, "What are the signs?" And so you want to feel for the pulses. The pulses would let you know the extent of the occlusion, because if you don't feel a pulse at all, well, that is significant. Doctor's probably going to give you an order to take that arterial line out. Did the pulses weaken? So before someone has arterial line placed, we want to be checking the pulses definitely before the procedure. And after procedure, we may check them about every 15 minutes to an hour. And that will be a sign that the occlusion is occurring and or getting worse. And that's when you can contact your physician. Number 21, what is the priority action when caring for a patient with a chest pain complaint? Is it administering nitroglycerin, obtaining a 12-lead EKG, assessing blood pressure and heart rate, or providing supplemental oxygen? And all of those sound like the right answer. And yes, is it Selamowit? It's me. You all have it correct, because not all chest pain is caused by the heart. Someone could have a pulmonary embolism. They could have coughed too hard. So we want to make sure that this chest pain is actually being caused by a cardiac issue. And the way to determine that is to obtain a 12-lead EKG, because it helps to identify cardiac abnormalities and guide the appropriate treatment in patients with chest pain. Number 22, which intervention should the nurse prioritize when caring for a patient with a new colostomy? Is it applying the skin barrier paste around the stoma, teaching the patient how to change the ostomy pouch, assessing the stoma color and perfusion, or administering a stool softener? Your patient just had abdominal surgery. Maybe they had abdominal cancer and they have a temporary colostomy. It could be permanent, but for our scenario, it's temporary. Are you trying to teach them about their care on the first day of surgery? You're not. They have a lot of issues. So, what are you going to be concerned about? And for all of you all who chose C, You have made Nurse Eunice very happy. I'm so proud of you. So, yes, you need to be assessing that stoma color. It should be a beefy red. If it is discolored, if it's black, that could be a sign of necrosis or tissue death. And so you monitor the color of the stoma frequently. It shouldn't have any gross or a lot of blood, but there may be some bloody drainage because this is a new stoma. 23. What is the priority action when caring for a patient with a suspected deep vein thrombosis or DVT? Do we want to administer anticoagulant therapy, elevate the affected leg, apply warm compresses to the leg, or obtain a Doppler ultrasound? Remember, it says suspected, it didn't say confirmed. So, how do we confirm that there's a DVT? That's your answer. Yes, Carrie, it is D. So, if you came to my facility and you told me that your leg was hurting and that it was warm, I can't start off by putting a warm compress or giving you heparin or some type of anticoagulant. I have to start off by making sure you just didn't pull a muscle. I need to actually order a Doppler ultrasound, and that's going to help confirm the presence of the blood clot in your leg, and that will guide the rest of the treatment. Number 24, which intervention should the nurse implement first when caring for a patient with an acute asthma exacerbation? Do we want to administer bronchodilators? Do we want to assess the oxygen saturation, place the patient in a high Fowler's position, or provide humidified oxygen? What do you want to do first? All of these sound good, right? I have a lot of C's. So and for this one, it says assessing oxygen saturation, but I absolutely agree with you all. We're going to make sure that person's sitting upright in a high Fowler's position. But it says first, we want to assess the oxygen saturation because it can help determine the severity of the distress and guides the administration of oxygen therapy in patients with asthma exacerbations. But I agree with you. For this one, it is C and B, not just B, because we want to sit them upright as the person is shown in the picture. And then I took off the other device. It was a asthma pump. So what we mean by gauging or determining the severity of the respiratory distress, if it's just a minor asthma attack, they can have their regular asthma inhaler. But if you look at this image, this person has a nebulizer treatment. So that means that we need to give a higher dose of medication and we need this medicine to go down further, which is why we're going to use a different device. So you monitoring those oxygen saturations will help us determine which route we should choose for that particular patient and their condition. Number 25, what is the priority action when caring for a patient with a suspected stroke? And I know all of you're going to get this one right. I know it. Is it performing a neurological assessment, initiating thrombolytic therapy, obtaining a computed tomography CT scan, or administering aspirin? You think someone's having a stroke. What do you want to do? Yes, 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 yes. You're going to perform a neurological assessment. And what we do, we think fast. So F, you're going to look at their face. Hey, is it drooping? Is it asymmetrical? You're going to ask them to raise their arms. Does both of the arms raise? You're going to ask them to speak. Can you tell me your name? And they're going to have difficulty speaking. It could be garbled. Hello, my name is. And then T, if you're in the hospital, time to call that code. If you're outside of a hospital, it is time to call 911. Hello, Jackie from Orlando. And so you all, you know that I hate leaving you, but It's the weekend. And so if you enjoyed the video, please like the video, subscribe to our channel. And I still owe a student a video on oxygen therapy. So I will probably try to get that video done before Sunday. And I'll come back online Sunday morning. I'll send out notifications. But if you don't have your notifications turned on, or if you're not subscribed to our channel, you don't know when I come back on. So please go ahead and do so. Make that commitment. And as always, I'm going to stay behind for a few more moments to see what questions you all have. This is Nurse Eunice with Florida Training Academy, and I have enjoyed spending this time with you. So let's see what we have here. Let's see what comments. You're welcome, Rosina. All right, so any questions, any comments? I'll give you all about 30 seconds. Thank you, Carrie. Rosina, if you can see me, I'm giving you thumbs up, girlfriend. All right, everybody. So you all have our email address. I'm going to put it back in the chat. It's admin@fltraining.com. This is a holiday weekend. So if we don't, respond right away, please give us the grace because our office is closed on Monday. You all have a great weekend, and I will see you all back on here on Sunday morning. Bye, everybody.